You can.
Okay. So describe to me, and I want you to remember, of course, this is a no embarrassment zone.
Okay. Describe
to me what Kirk's urine sort of sounds like. Just sort of imitate the sound for me.
Sadly enough, I know this.
You do?
When we were younger, it used to be like a racehorse, but now it's more like trickle, trickle.
Trickle, trickle.
Amongst the other noises that come out of him, you know? Back off, ladies, he's mine.
So based on what you're describing, I got a little demonstration for you. I want you to tell me if you sound like this.
Okay.
All righty. Now, let's just pretend this is you, and you're sort of sitting there and you're waiting. All right. I was coming.
I'm just as eager, by the way, too.
All right, start it off. I'm a little hesitation here. There. Oh, there. Does that sound?
You kind of got it right. Bingo!
Did I get it right? And then you get yourself all wet like this. All right. Let me show you what's happening. Because I actually got a little demonstration for you. So, this is the anatomy of what's happening inside your body. It's actually pretty informative. So there's the bladder up top, there the urethra's coming in, and then inside the bladder, of course, the urine's pooled, and eventually it goes through the prostate, which is right there. Now, the prostate gland is designed very specifically to allow extra fluid to be milked into the urethra that's coming out through the penis here. But over time, you see how it squeezes down, you see how less space is available? As you slowly constrict this long pipe going through the prostate, you start to have a difficulty initiating the stream of urine, because now the urine's stuck up here in the bladder. It cannot get through this little opening, and it's a long, narrow tube. So any problems in here, a little inflammation, irritation, and all of a sudden the whole thing shuts. So how many people in the audience, put your hands up, men, how many of you are having problems initiating a stream? Maybe you're going to the bathroom more than once a night, for example. You have to get up at night to go to the bathroom. How many honest men are there out there? There are a couple of them out there. All right. Now, simple treatments. Kirk, and I'll give this as my first line therapy. Yes, you could have surgery because they can just bore out that little hole.
Right.
Have you had that?
No.
Not yet. Right. It's a little uncomfortable. They go to the tip, they go in there with a little rotor and churn it out. But
I'll pass.
You'll pass. what works for a lot of guys, there's some very effective medications, prescription drugs, but I actually love saw palmetto. Which I think works pretty well as a first-line therapy. It's an inexpensive herb. It's used. You got to make sure that your physicians know about these herbs because they do have interactions with other pills. But it's worth trying for the many men out there who are having a little bit of hypertrophy. And the other thing is daily non-steroidals are actually pretty effective at lowering the risk of benign prostatic hypertrophy because fundamentally we think it's about inflammation.
Right.
And inflammation of the gland causes it to get thickened, a little swollen, and that causes a lot of the problem. Fair enough? Here, take those home with you.
Thank you.
Woo,
and you make sure you take them.
I will.
I'm going to thank Nicole and Clark. For more information, visit drraj.com. We'll be right back.